Greetings to all of you. I am Manjaree Pant, the Communication for Development Specialist with the Rajasthan Field Office of UNICEF India. And on behalf of Professor Nisar Ahmad and Ryaddin Ryad, I am going to take you through our journey of faith leaders' engagement strategy for risk communication and community engagement in Rajasthan. Rajasthan was one of the states which saw an early onset of the pandemic in India. As the virus spread, the government embarked on the cluster strategy of test, trace, and isolate. The team of health functionaries were engaged in door to door surveillance. In fact, curfew was also imposed in certain areas in a bid to enforce the containments and lockdowns more successfully. Yet, the biggest challenge was a low uptake and compliance to this surveillance and screening strategy of the government. In fact, the first month saw less than 841 tests being undertaken per million, which was abysmally low. Some of the reasons on probing were found that the prevalent mistrust and doubt of the underserved populations began to manifest itself in the people's judgment, and it became a hindrance towards cooperation in the surveillance. Fear of religious-based, community-based discrimination shrouded the health-centric intentions and instigated a mass resistance and non-conformance to COVID-19 specific behaviors. There were these new norms that the community had never heard of: social distancing, mask wearing. All these were a new addition to the collective vocabulary. Naturally, they would have taken longer time to adopt, especially so in an environment which had a plethora of festivals coming up, festivals that were mostly celebrated collectively in the state. And now these new norms were putting a barrier on the same celebrations. In this time of uncertainty, religion was the one constant, and yet, with the lockdown being imposed strictly, social distancing manifesting itself in the most intimately held domain of religion, the enforcement meant that these celebrations were now under a big question, and the psychological support, the psychosocial support that the religious celebrations, congregations gave was now missing. To tackle these challenges, the government of Rajasthan, with technical support from UNICEF, invoked the power of faith as part of the risk communication community engagement strategy. A multi-faith engagement was embarked upon, both for upstream and downstream advocacy. In fact, the engagement started at the highest political office of the Chief Minister, who himself engaged with multiple faith leaders from across the state. This was followed up by a very smooth operationalization by the state administration in the leadership of the ACS Health, and was then taken forward through the offices of the district collectors across all districts. A mapping of faith-based leaders and their circle of influence was done very conscientiously. And based on this, a consensus was developed amongst them all on the key areas, key issues which had to be tackled in this moment of uncertainty, and a uniform set of messaging and shared objectives was embarked and arrived upon. A collaborative approach was then undertaken with each one of them to identify the appropriate hooks and the entry points that their religions and faiths offered, to find the right instances for faith-based engagement, to endorse and support the surveillance strategy that the government was embarking for the larger social good. Based on these hooks, based on these approaches, a resource pack was developed for messaging and was taken up by these religious leaders across the state and adapted into their own in their own discourses thereon. A multimedia approach was undertaken to build the momentum. Community-based WhatsApp trees of disciples, social media, mass media platforms were all used to reach out to communities. When the public announcement systems in your own neighborhood and that of the adjoining area were blaring with the same appeals, same messages through different voices of your known leaders, the fear of stigmatization came down tremendously. In fact, a frequently asked question mechanism where people could come back with their queries, with their doubts, and their own leaders could respond to them was also established. The media, especially the radios and the television channels, and including the print media, all of these took the messages even forward. The same appeals were taken forward for greater amplification. Multiple stakeholders across the various layers of the social ecology of Rajasthan were holistically engaged with. And you will find that the engagement of the faith leaders was in a dual capacity. Those leading congregations and faith based organizations contributed to the higher level advocacy and development of an enabling and inclusive environment. A second category of local faith leaders and influencers was instrumental in the downstream advocacy, engaging with communities, unpacking the religious scriptures, and aligning it with their new diktats of the COVID appropriate behaviors and promoting behaviors through a contextualized approach in their own languages, in their own contexts, for further, much better assimilation by the communities. The Correct 19 model for faith leaders' engagement recommends 8 different desired roles of faith leaders. The Rajasthan Faith Engagement Strategy actually relied on many of these roles. For example, as faith setters, the leaders' communication helped in clearing the misinformation and the trust of the communities was revived again. As health promoters, they not only interpreted the scriptures to support the desired health behaviors, they also worked in close coordination with the health department to remove any obstacles in those. As community mobilizers in the post lockdown time, the faith leaders have mobilized communities to continue to practice COVID appropriate behaviors and stay aligned for the larger good. As peacemakers, they provided the much needed healing touch for integration and inclusion and coming together to fight against this larger pandemic that has been affecting the societies. This intensive engagement of and by the faith leaders contributed, contributed to a dramatic increase in compliance. In fact, the strategy worked to enhance trust, eliminate stigma, and encourage people to go for testing and treatment. Partnership, ownership, empowerment, and reinforcement are the critical principles of this trust relationship. In our experience, this direct engagement strategy involving the state, district, and sub district level faith leaders proved to be successful, replicable, and cost effective. It also offered a common platform for a common purpose to overcome the risk of polarization. However, there is a greater need to consistently invest in constantly finding a common ground amongst all the faith leaders so that everybody can be brought together on key areas. These religious groups are constantly evolving, so a sustained engagement and orientation on child rights and responsibilities will be required to maintain the focus on desired outcomes for children. Thank you so much, and we look forward to learning from your experiences as well.